Hi.
Sorry, I'm in my car.
Oh, that's okay. I'm thinking I'll kind of like do the whole interviewer role and then we can pause after
Okay.
each answer and I can kind of like tell you how it reads to somebody who doesn't know
Sounds
you at all.
good.
Okay.
Sounds good. Mhm. Okay, there we go. Can you hear me?
Yeah.
Yeah, I can hear you. Perfect.
Okay. Are you ready?
Let's do this. I do. Yeah, I'm ready. Let's go
Okay.
for it.
So welcome. Thanks for coming to interview with us today. We're just going to start out with questions that we have for you, and then we're going to leave a little bit of time at the end for any questions that you may have for us.
Okay.
So if first, if you'd like to just tell us a little bit about yourself.
Sure. So I'm actually in the process of finishing up my bachelor's degree online. I have been working as a RN in med-surg for the past year. 3 months of that have been working in the emergency department where I learned a lot of valuable lessons in terms of triaging, um, titrations, being part of codes, um, and also just having better communication with staff, learning how to collaborate with the team members. So I found that very valuable information. Also, prior to that, I worked as an LVN for 3 years where I challenged the board to get my LVN license. I worked in a SNF where I've learned great patient management, having to take care of 30 patients at a time. I transferred into the ED Express Care where I was able to hone in on my skills of starting IVs and just perfecting that and just having collaboration with the team. I thought it was really important to work together as a team. And so the reason why I'm applying for this position is because I just, having worked in med surg, I love that critical thinking, that in-depth thinking where you're having to think on your feet. And I love the environment, taking care of up to 5 patients at a time, having the support of your team, I feel is very important. And just, being able to apply a lot of the skills and knowledge that I have obtained. I got interested in this position because I had a grandmother who was sick and she was in the hospital. She had cancer, and I just really valued and loved the way the nurses took care of her. And that kind of got my interest because my grandmother is my role model. And so that kind of started my drive into nursing. And so that's kind of where I'm at here. I just wanted to be able to provide that same type of care. And it's something that I would do over and over again.
Cool. So what I get from
So,
that is that you want to be challenged, you're up for a challenge, that you're strong, adaptable, and that you really do value working as a team, that like you're excited about that. Okay, I feel like this one is like an obvious one they're going to ask. Can you please tell me about a time where you had a difficult patient?
yes. So I had this one patient who, I had came into work. I got the report on him. He had several surgeries, and it was just taking a little while for things to heal. So the patient was grumpy. He wasn't happy with the fact that the nurses were coming in and just doing whatever they want to with him without speaking to him. So at the start of the shift, it's like a lot of staff were saying, "Oh, can we switch patients? I had this patient, da 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 da." And I knew that the patient still needed to be cared for. So it's like, yeah, I'll take the patient. So I ended up going in, speaking with the patient, finding out what his concerns were, and, just trying to decipher why the nurses were finding it difficult to care for him. So what the patient explained to me was that, just listening to him, he told me that, all he wanted was someone to wake him up before they slapped on the blood pressure machine to take his blood pressure, and he would cooperate. It's like, just let me know that you're doing something before you do it, because, that's one of the things that was missing. And so with that, the patient had used a few profanity words, and I let him know that, hey, I'm here to take care of you. It's not okay to talk to me that way. I will not talk to you in that manner as well. I'm here to help you. And so I did inform the patient before I did any invasive procedures or just even touching him, and the patient was cooperative with that. And so I was able to go in. He was still a little grumpy at times, especially if he would sleep. So I gave him a little time to kind of cooperate. I mean, um, just to wake up and allow these things to happen. So after that, there was no problem with this patient and me, and he just became more cooperative. And he also even opened up and shared some of his background history with me. So we kind of formed a relationship, and we had a few little laughs in between.
So can you please tell us why you make a strong candidate and what you can bring to our team?
Yeah, so, I've worked in a few specialty departments throughout my nursing career. I've gained a lot of valuable knowledge and skills that I feel are applicable to this particular position. I love just being that person that brings positivity, just being able to collaborate with others, and I'm not afraid to ask questions, because I never want to compromise a patient's health care. So I'm not afraid to speak to the doctors, to the nurses, to our CNAs. I feel that everyone brings something valuable to the team. I know that knowledge is important, and I also bring a lot of knowledge to this particular field. And I've read about, some of the things that you're looking for. So being that, I want to learn, um, I think I screwed that one up a little, but I'll continue. I want to be in a place that's invested in their staff. I want to work for an organization that provide high quality care to their patients. And I'm big on education. I'm big on learning, and I want to be able to apply those skills and feel like I'm a part of a team that's giving back. And so that's the reason why I want to work for this team, because you're big on research. You're always doing research and bringing innovative ideas. And I just want to be a part of that. I think I stumbled a little.
The stumble is okay though. Like when someone stumbles, it kind of like humanizes them a little bit, especially like if they laugh and you're like, oh, I like this person. You'd be like, oh, there's a little bit of their personality. That was cute. It's not a
Okay.
big deal. Maybe talk about, because I think just the brief look over their website, I think they were kind of bragging about like how they have better patient outcomes compared to the national average, or like, so you could talk about how like you like how they have a focus on like continually improving patient outcomes, and tie it into the thing about like how you want to like continually learn, and you like that they're focused on research, because I think that's sort of like their bragging goal, that they want to like keep moving forward. But no, I think that was good. It wasn't too like because I'm the best and because I have all the, it was like the right amount of that, but also like what you can do with them. I think it was good.
Okay. Okay. Thank
Um,
you.
but what are your
It's
biggest strengths and weaknesses?
sure. So I would like to think that I'm a great communicator. I'm able to communicate with people. I'm not afraid to let people know what I don't know, because I, again, never want to compromise patients' health or their care. I think that I'm outgoing. I bring a lot of positivity into the environment. I'm easygoing person. I work well with others. I love the fact that there's different entities that are caring for patients, and I think that they all bring something valuable to the team. So it's not just one person. So I just like that camaraderie, and I like making a difference in the lives of those that I come in contact with. I'm also I'm a hard learner. I mean, like a fast learner. Sorry. Um, it doesn't take me long to learn something. And if it's something I don't know, I'm going to research it first before I reach out and enlist the help of others. You know, I'm going to do my part and give it 110% before asking for help. And I guess one of the negatives I have is that I'm really hard on myself. You know, it's easy for me to give advice, and I hear from friends that, wow, you really give great advice and you're a great listener. Um, but when it comes to myself, sometimes I beat myself up if I make a mistake or if I do something that I feel is could have been done better. So it's like just being able to be a little bit lighter on myself is something that I'm working on. And you know, that's kind of where I'm at with those answers, I guess.
Can you tell me about a time where you had to give constructive feedback to a coworker?
Yes. So I had a coworker, and this was kind of new. I think in my practice, I had a coworker whom I was in the room with the patient, and the patient had just came back from CT. They had a new colostomy bag placed on them, and while I was in the room, the coworker was I was trying to, I had never changed a colostomy bag before. And so I was just trying to figure out how to assess the situation because the bag was leaking a little bit. And I didn't know that once you come back from CT with a new colostomy bag, that you may have a leaky bag at times and you may have to change it a few times because of the hardware. So what happened was the coworker was kind of, I felt like she was dismissing me in a sense, you know, like my knowledge and my skills by saying, "Oh, she's new." Like, yeah, just never mind her, like she's, you know, that kind of thing. So after that, I pulled her to the side and I spoke with her and said, "Yeah, you know, although I understand you trying to help in this situation, but if you had any concerns, if you don't mind for future that you would talk to me to the side because it really made me feel incompetent as a nurse. And given the fact that this coworker was a CNA who had been there for 10, 12 years, didn't really help the situation. The patient was asking, "Oh, so, oh, can I have the other nurse?" I go, "That was the CNA. She's not actually the nurse." "I'm actually your nurse." It just kind of made me feel incompetent. So I just, you know, I just appreciated that she was trying to be helpful. But in the future, if you can talk me away from the patient, I think that's would be the best idea because even though I'm new, I'm still the one in charge of the patient, and I don't want to give the patient any misconception that I don't know what I'm doing. Yeah, I just have to walk in with my head held high and look positive and have my confidence radiate while I'm in the room with the patient. So, yeah.
Okay, good. I like that. That was actually pretty funny.
Thank you.
So, what are your short and long term goals? Where do you see yourself kind of in 1 year and then in 5 years?
So, in 1 year, I see myself possibly getting like certified in my department and in med surge. I see myself just honing in more on my skills, being the best nurse that I could be, just being more proficient at that. My 5 year goal would be to possibly obtain a preceptorship. You know, I see myself teaching new nurses coming into the field, possibly being a charge nurse in my department. I just see myself being part of the committee of learning different and applying different research knowledge, just being an educator and within my department.
Love that.
Those are my goals for now.
So when you
Thank
say
you.
that, what I hear is, okay, cool. So if we hire her, she's not going to leave in a year for like, you know, NP school or whatever. Not that that's a bad thing that people want to go to NP school, but I hear that like
Mhm.
if we did hire you, you would actually like stay for a while and help with whatever staffing need they're trying to fill. So that's good. And it felt really genuine. Like you were just like humble, but like also really wanted to grow. I like that.
Thank you.
Yeah. Um, let's see. Have you ever been told to sacrifice quality care for efficient care by a supervisor? How did you handle this? Or have you had a disagreement with
Huh.
a supervisor?
Um, can I have a second to answer that?
Yeah.
Let me think. Thank you. Um, I think it would probably have to do with something about policies and procedures. Just, sometimes it's a matter of time management. And I've had a management tell me that, okay, we need to kind of pick up the pace or be to try to so that you get out of here on time. And so it to me, it just kind of felt rushed because I want to always first adhere to the policies and procedures because that shows the best practice, the best evidence practice for the patient's care that's been proven and tried. So I don't want to have to rush through something because of time constraints. And so just learning how to be more proficient time wise and managing my time to get tasks done, I had to kind of implement a plan to do that. Maybe if it meant me like just being prepared in advance. I think that was mainly it. There was that disagreement about just trying to get through stuff so that you can clock out on time. So I think that I don't know if that answered your question or not. I think
I think
yeah.
we can work with that. Um,
Okay.
keep thinking if you think of something later that we could use for this. I would frame it as like that you like time management is something that like I guess say it in a way where it seems like you don't have a problem with time management, like that it's
Mhm.
something that you have worked on and made a lot of progress on over the years and you feel comfortable with it now. But there was an occasion where multiple things needed to happen right at shift change and you wanted to follow policy and do what was best for the patients, and like maybe there was a concern about like they didn't, whatever it was, that like they wanted you to get out on time. And
Okay.
yeah, like make it sound, because when you said it I'm kind of thinking like, oh, is this like a pattern for her where maybe she doesn't manage her time, or like is she telling me that like she's always staying over? And as a manager, like they tend to be kind of conscious about budgets, and so they're
Hmm.
like, maybe she's really expensive if she's always staying over. um that's kind of like
Yeah.
the red flag that pops up with that answer. I think you can like
Okay.
tweak it a
I,
little bit to work with it. I don't
I
think you'll
gave you
just
a red
drop it
flag.
completely.
I think the better one would be that, so since then, since I having that conversation with my management, what I did was I did see that some things were taking me a little bit more time to accomplish because the time involved of certain procedures or tasks. So what I did was I would come in early, at least 20 minutes early. I would gather all my patients' information and data. I would put it down on my worksheet, on my to make sure that I know which things to approach first. And I think that kind of helped me with my time management, just being prepared in advance. Although this was time that I came in on my own, it wasn't against the company. Just so that I'm more prepared and I can set aside my priorities, like what things need to be done first. So that approach has worked for me. It helped with my time management. I'm able to go in and tackle things that need to be done. And I'm now learning how to get I've been able to get out on time.
I like that you said you've been able to get out on time. Maybe another idea
Okay.
you could work in is like like maybe it was a bunch of things happening right at shift change, and maybe you learned that it works better if, like, when you do have downtime where your patients don't need anything, to make sure like you've gotten all the other responsibilities done that you can do.
Oops.
um like, making sure you've done all your charting, and you've given any meds that can be given, or done any dressing changes, and not leave them just in case something comes up, so that you can like still get out on time even if something unexpected happens. Because then it kind of makes it sound like it wasn't your fault. Like, everyone has had that like random stuff that happens right at shift change, maybe.
Sure.
I
That
don't know,
makes sense.
just an idea.
Okay.
Yeah.
I'll take it. That
Yeah.
makes sense. Yeah. Thank you.
Yeah.
Good feedback.
Yeah, right. It's like you get an admission, someone else needs to be discharged, and like somebody else
Oh God.
starts pooping blood, and you're like, God, I can't be in 3 places at once right now. What am I supposed to do? And you stay over.
Yeah.
Thing,
So yeah, I agree. So it's kind of like, in situations like that, these are real situations that have happened. Like at the beginning of shift, I'm already being told that there's a discharge, and I've gotten a report, and I see that some of the patients may need fluid replacement, and I'm getting an admit in the next 30 minutes. So, and I'm still trying to get reports. So I would ask out to the break nurse and see, hey, maybe can you help with the discharge, so that I'm making room in my schedule to handle the admission that's coming in, because I want to be the first one that lay eyes on this patient and gather the information. So I get, and then, yeah.
Yeah, I like that. That works. No red flags
Yeah,
with
those
that.
are real situations.
Yeah.
Thank you.
Okay. Let's see. Oh, tell us
Uh-oh.
about a time where you made a mistake at work.
I've never made a mistake. No, just kidding.
I don't make mistakes, first of all. I'll have you
Yes,
know.
not me. I'm perfect. No. Okay. Well, so I had a patient who needed a urine sample collected, and I went ahead and got the urine sample from the patient, and then I went ahead and sent it down to the lab. And later on in my shift, like an hour or so later, I got a call from my charge nurse, and my charge nurse was telling me that the lab had contacted her and told her that, that the patient didn't have an order for a urinalysis test. And so I thought that was strange. So I took a look at it, and they actually, I guess, come to find out that it was for a different patient. So what I did was I had put the wrong label on the patient's urine sample, which was for another one of my patients. So then I had to apologize to the nurse, but my charge nurse, that I did that. I also went back to the patient's room. I apologized to the patient, and I explained to the patient what had happened, and that I would need to collect another urine sample. The patient understood, the patient was cooperative, and I was able to resubmit another urine sample for that particular patient, and get the results out for that. I guess the thing that I learned from that was that this could have went very bad. I could have given or had medication given to a different patient, although that patient didn't have any issues going on with them in terms of their urine sample. So I've always learned from this to double check my work to make sure that I'm putting the right label on the right specimen, and that to prevent this from happening in the future.
Like, you took ownership and you handled it, and like basically, like, they usually give you a rubric where it's like full, like 1 to 5, like how many points do they get, and usually the points for that kind of question are about um like, did they own up to the mistake and make changes going forward. Like, if the person being interviewed says like, oh well, I mean, it turns out I didn't make a mistake because turns out I was right, and you're like, oh, I don't know, I can give you full points for that. Like, I'm glad you were right and you didn't make a mistake, but like, it's better if you have something where like you actually took ownership and like made changes. So good job on that
Okay,
one.
perfect.
You're
Thank
making
you.
this too easy on me.
Woohoo. I'm not trying to.
Okay.
Even though it's coming across a little mumbly jumbly at times, like I'm stuttering here and there, but
I
it's
think it's like a
just
normal
that,
level. You
yeah.
don't want it
Okay.
like too pageanty, you know what I mean? It feels like I'm
Yeah.
like
Okay.
talking to a real person.
Okay. Perfect.
Um, let's see. Oh, on your last performance evaluation, what did your manager say were your greatest strengths and what were your opportunities for growth according to your manager?
Wow. Let me think. It's been a little while. So, from what my manager pointed out to me is that, oh, you have great communication skills. You're always available to help out, to jump in. That the staff don't have to wait to incorporate your help. That you just voluntarily go ahead and just kind of volunteer your services where you see a situation occurring. So that's like a really good plus for you. And then the things that I could work on is probably giving other people the opportunity to provide their input into a situation, like giving them a chance to provide ideas. And I guess for me, like if you're working on a project, like I don't have to be the only one that's responding. Like give other people a chance to learn, give them an opportunity to learn. And I think for me, that comes from a place of just having just that quiet energy, like if you're just sitting there, I just get nervous when people don't talk. It's just being able just to sit and allow other people the chance to participate in the care. I think I'm being judged when there's just that quiet energy in a room. And I think that in my mind, I'm being told that, hey, okay, people are judging you. They're gonna think that you're dumb, you don't know anything. So it's like I just feel like I have to say something. So just learning to pull back and allow others to participate in meetings or ideas or what have you.
Okay. I like that answer. It's like a unusual one, but I like it. Yeah.
Yeah. Yeah,
Um,
it's just that quiet silence that you just like, I have to say something, that kind of thing.
can you tell me about a time when you had to take action on a clinically deteriorating patient to keep them safe?
Yeah, so I had this patient who was ready for discharge, and um, so when I got to work, I got the report and everything. As I was heading into the room, I went ahead and made eyes on all of my other patients, and then I got to this patient. I knew that they were going to be discharged, so it's like I kind of waited to get to them last. So when I saw the patient, I just felt like something wasn't quite right with them. Like they weren't making that connection with me. Their breathing was elevated. The respirations were like 32 after I did my assessment. The wife was in the room. They were all set, ready to go. The wife had already went out to get his medication so that he'll have it to go home with. And I was just supposed to come in and discharge the patient. But when I looked at the patient, his stomach was distended. It looked as if it was about to burst. And so I just did an assessment on the patient because I had him the day before. I quickly pulled his pant legs up. I saw that he had bilateral edema on both of his lower extremities. And I enlisted the help of the wife because I don't know his legs. So I asked her, was this normal? They were so tight. And she said, no, that's not normal. And so I called the charge nurse and said, can you come into the room with me? This patient is not ready for discharge. There's no way I could let him be discharged at this point, even though the doctors aren't there with the patient. I'm the one with the patient who knows him a little bit better. So after my charge nurse got in, she also did the assessment with me. We called rapid response. Rapid response came in. They did their assessment. We got the patient back into the bed. The patient ended up being transferred to ICU, where he had 1.5 liters of brown fluid removed from him. And so I was so grateful that, I was able to use my critical thinking skills, like just that in-depth thinking, that just knowing that something wasn't right and I was not going to release this patient. A week later, I ran into the wife in the hallway and she had on this scrub jacket. And I thought, does she work here? Because she was speaking to me and I couldn't quite remember her, had the mask on. And she was like, "You saved my husband's life. Like, if it wasn't for you, he wouldn't be here today." So I felt really honored about that. Just knowing that I was able to sense that there wasn't something quite right with the patient and get him the appropriate help that he needed. So it felt really good. And it's kind of like, that's the reason why I do what I do, because I want to make a difference. I want to catch those things, and being a new nurse, I thought it was really valuable. And it was also brought up in like our huddle that, hey, from my management, oh, she saved a patient's life. And, we got to we have to look out for these things and make sure we're always keeping our eyes on the patient and monitoring them correctly.
I really love that. The only things coming up in my head, like as an interviewer, is like, wait, so I assume by assessment she like took vitals. Were there any vitals changes other than the respiratory rate? Like, is this guy in heart failure? Like what's going on? I don't like, I want to know, like, like, because I kind of picture myself there and I want to take the vitals. I want the data and like the changes.
Okay. I think I left that part out and I should have included that. But yes, I did get a set of vitals. We did the respiration. I took his vitals and his blood pressure was low.
How low? Super low?
Was his? I'm trying to think, because I had a couple of situations like that.
It's hard when it's a while back.
Actually, let me take that back. Yeah. So I think actually his blood pressure was higher than what it normally was. So I had 2 critical patients. His blood pressure was high. He was running a slight fever. It was 101 point something or 102. His heart rate was up. Respirations were up. Like all the signs were up. So all this valuable information was information that I end up communicating to the doctor about the patient, as well as the next unit that received the patient.
I think that helps.
Just saying that up front.
Like, yeah. She called a rapid because someone's legs were swollen. Like what else? Like what? I think it makes more like it makes more sense when you say the vitals changes too. So what was it? Heart failure or what happened? Do they know?
Well, no, it wasn't. I mean, he had a lot going on, but he, like I said, he had all this fluid that was building up inside of him. So they had to do a paracentesis on him to get the fluid out. He didn't have heart failure, but he did have some CHF stuff going on, prior to that, like a chronic history, I guess. But it wasn't like the main reason why he was there. Yeah.
Interesting. Okay.
Yeah. Cool. Just trying to remember the details. I guess I should remember that stuff too, but
I think that might be the best answer I've ever heard to that. Like hands down.
Okay. Thank you. I also had that same patient who was cranky and didn't want people just coming and touching him without letting him know. Like this patient was complaining. The charge nurse told me that the patient was complaining of a fever. Like, no, he was cold. He was freezing and he was like, go and check on your patient. So I'm not going to like downplay or throw anyone under the bus, but this was the information I got from the charge nurse at the beginning of my shift that, hey, the patient is complaining about freezing and, it's warm in the room. So I went in and to go check on the patient, and the patient, sure enough, was shivering, under the covers. I checked the thermostat. It was like 72, 74 in the room. I did a set of vitals on the patient. The patient had 103 fever. He was shaking. His blood pressure was low, and he just was not himself as well. And so I definitely called for rapid response after I got this information. I felt that the patient was being septic, and I want to protect his vital organs. So charge nurse, I got my charge nurse in, I called rapid. There was a problem with the bed. We couldn't get the bed to work. So there was electrical problems there, manufacturing problems. So patient ended up getting several boluses of fluid to try to bring his blood pressure up. Gave him IV Tylenol to try to bring down that fever, because initially I gave him just PO Tylenol to see if that worked, but he still had low blood pressure. So I reached out to the doctor too, got a bolus, got all this stuff going for the patient. The patient got transferred to ICU. The patient was septic. We got a lactic acid done on him, and so the first one was a little above 2, and then the second lactic acid result was still elevated after 6 hours. So definitely the patient was going through septic shock. So he got transferred to ICU. The patient ended up coming back to my floor a couple of weeks later. I was like, what? You're still here? Eventually he got discharged, but he had some surgery and it was just taking a while for things to heal. So yeah, another proud moment for me.
I think that one's good. I like the other one better just because like the visualization I get of like you seeing that woman in the hallway, like that really stuck with me. And I feel like they remember the pictures that you give them, you know? I think this next one might be better for like, if they say like, tell me about a time when you collaborated with others, or like anything involving like communication, teamwork, you can like use for that too.
Thank you. And I have used that one for that. I think I made a note to say I could use this as a collaboration, because it's like I got asked the question, tell me about a time where you had to collaborate or work with other people. And I was like, yeah, okay. And I used that. I didn't know what I was, but I just figured it was a collaboration part. Yeah. Okay, good to know. Thank you.
Work it in somehow. It's a good one.
Okay. Yeah, thank you.
Let's see. This is another popular one. Give us an example of a time when you've been an advocate on behalf of a patient.
What was that? It was kind of in and out. I didn't get it.
What
was the question?
Give us an example of a time when you've been an advocate on behalf of a patient.
Okay. Sure. Let me think. Give me just a second to think about this. Okay, yeah. So there was this one patient that was constantly getting his blood sugar checked. Although the patient was able to maintain his blood sugar level, he never went outside the realm every time his blood sugar was checked, and he had good compliance with his blood sugars at home, even outside of the hospital. And, the patient was very compliant with allowing us to continue to do finger sticks every 4 hours. However, because his levels were well maintained, and the patient was having to be woken up throughout the night to get finger stick checks, I went ahead. The patient was asking me, "Is this really necessary? Everything is fine. I'm totally compliant with my diet and everything." And I said, "Well, let me see what I can do for you. I understand. I do want you to get rest and everything." So I reached out to the doctor. I let them know that, hey, every time I've taken his blood sugar, his levels have been fine. It's been within the range, and the patient is compliant, and and besides, he's going home the next day. So I was wondering if we can just not do the blood sugars anymore, because he seems to be on plan with his blood sugar levels. And so the doctor agreed and they DC'd the blood sugar checks. And so then I went back and I spoke to the patient and let them know, hey, we're not going to be poking you anymore. You could get some rest. We will come in and do your vitals as required throughout the night because I work night shift. And the patient was so appreciative that, he didn't have to continue to get his finger pricked. He thanked me for that because I guess, he had been mentioning this to staff, and I just wanted to kind of like see what I could do to help get this alleviated so he can have a better rest of his stay.
Okay. I feel like you do this thing at the end of your answers. I can't really put my finger on what it is. It's sort of like you kind of give this look of like, is it okay if can I end here? Is that good?
Okay.
It's a thing that you're doing.
Oh, okay.
Maybe
I'm
like
doing that.
like a confident ending of a sentence.
And that's how I go about. That's how I went about going above and beyond. Okay, that was my way of advocating for the patient. Okay, I'll just do that.
Yeah.
I feel confident in my response, and that's how I advocate for my patients.
Love it.
And this is how I collaborate with other team members. Okay, I got you. Okay, thank you.
But like,
all right.
Yeah. I
can definitely clean that up. Okay.
But like, don't make it like uniform after each one. Like one of them say, like, this is what I found is really important to me when I'm faced with that kind of situation, or like how, whatever. I mean, you're good at.
Okay. I can mix it up.
Yeah,
for sure. I'll mix it up.
I don't know.
I don't know if I'm just saying this because we're doing this mock interview, but I can't recall if I don't think I do that in interviews, but I don't know.
Okay.
But those are good points, good takeaway points. So thank you.
Maybe it's because I'm coaching you, so you're waiting for me to be like, red flag.
What do you think? Yeah, right. What's your response?
What's the verdict?
Give me some feedback. Yeah.
That's probably it.
Okay.
I don't feel like they'll probably ask you this one, but I'll throw it in just in case. Okay. Describe any leadership activities you've held in your past positions.
Well, I don't know if it would be considered a leadership per se position, but I have been involved in situations where I have alerted the attention of others. I have taken the initiative, certain situations. On one occasion, so there was a patient in the clinic. I was working in a clinic that came up. So the wait times were like 4 hours. And so I just happened to be at the front desk because I was the float person. So this couple came up and they were trying to check in. And once they realized that it was a 4-hour wait, they didn't want to wait. So they immediately turned around, headed out the door. But I could tell that there was something quite off with the wife. And so what I did was I went out to the parking lot to try to catch them to gather more information before they left. And during my gathering of data, I realized that there was some loss of memory, like the patient possibly had a stroke at the time. So just gathering information from the husband and the patient not being able to articulate correctly or respond to my questions. So what I did was I got the patient back in and I just let the front desk know, hey, go ahead and check them in. They're going to stay. What I did, I went to the back, I spoke with the doctors, told them, hey, I think this patient is probably having a stroke or had a stroke. This patient needs to be seen. This one needs to be triaged up the ladder. And so they ended up getting the patient into our cardiac bay. The patient got assessed, found out that the patient had a stroke and that they were within that time frame of possibly receiving any TPA. The patient was then rerouted out to the hospital where they were given follow-up care. Not sure what happened after that, but yeah, the patient had a stroke, and just me jumping in there and taking that initiative and just being like a leader and realizing that, hey, this patient needs to be seen and not just sent away. I just felt like, this was something that was important, that to be able to spot these type of things in advance, even if you're not the one directly um, in charge of the patient's care.
I think you could even use this one for the advocate question too. This is a good one. I don't know if I'll ask this, but do you have any hobbies, or like what do you like to do on your days off, or like what's your like self-care routine for stress?
Oh, so I love going to the gym. I love working out. For me, it just kind of re-energizes me. I feel it kind of releases those positive endorphins. It just kind of relaxes me. I also like going into the spa and the steam room. It just kind of removes all the impurities. I feel so relaxed. I just feel like a weight is lifted off of my shoulder. I really like doing that. And also getting a massage, just being relaxed. These are some of the things I like to do. And just, hanging out, talking with friends or family. These are the things I like to do to kind of like leave my work at work. This really does help me to unwind.
Okay.
What's your pointers on that? What are they looking for?
So I like that if they ask about like a self-care question, if they ask you specifically about hobbies, they're basically saying like, tell me something like completely unrelated to nursing. Like, I want to know you, like, what's something like you wouldn't normally say. Like, like people, they might say like, I really love to cook. Something like where they're like,
okay. I think the last interview I had, oh, tell me, what do you like to do to unwind? I did get that question. And
okay.
then when I said, oh, I love a massage, and it was like, ooh, yeah, I love that too. It was just me and the manager and she was like, oh yeah, I like that too. Oh, maybe I should go get a massage. Good idea. Yeah.
Yeah, that's what you want.
Yeah, it was just the two of us.
Yeah, I think a lot of
when
people
they
like
respond. Yeah.
in an interview, you don't see them smile until the end when they're like saying goodbye, and you're like, there you are. Like, I just spent an hour talking to you, and you didn't show me any of your personality. Like, I just caught a glimpse.
Personality has just shown up. I'm trying not to be.
Yeah.
And I think
you're good at
okay
like
to use your hands.
totally.
Is it okay to use your hands to express yourself? Because I think if I do this, I just feel more stiff and more like robotic. Like I cannot move. I'm confined to this chair. I cannot move.
And they'll be like,
I
what's
like
wrong with your hands? Why is she
yeah.
doing this?
Move on, because it's like, just relax, be you, be yourself.
I think it really goes a long way.
Don't approach it. Yeah, don't approach them like they're your friends.
Right.
Don't get too comfortable.
I've seen it go the other way too, where I'm like, oh, that was risky.
I don't want to do that. Keep it professional, keep it light, and just stay focused. Okay.
What happens if your shift replacement didn't arrive on time or at all?
That would really suck. No. Oh God, true story. It happens. Hey, things happen, there's traffic, whatever reason, you're the person who's going to be taken over, you may be late, you don't abandon your patients. So I would stay with the patient, try to get as much done. And if I'm done with my work, I'm going to reach out and see, hey, if my other colleagues need any help, maybe I can help out there, or, work on my health stream or something. But I would definitely go back and check on the patients and let them know that, hey, I'm still here. If you need anything, I'm still here. You will be getting a new nurse. They will be here shortly. So in the meantime, if there's anything you need, just let me know. Okay, I'll be around. Yeah, definitely. it sucks that you're not going to leave on time, but it wouldn't be the first time. And so, yeah, you're just there. You can't abandon your patients.
Yeah. Okay, perfect. Okay, so we have 3 minutes till it kicks us off.
Okay, perfect.
Do you have any questions that you want to like that you're like unsure about?
Oh, okay. So these kind of questions for you. So what do they so is this kind of like, oh, just unsure about?
Yeah,
I think we kind of answered those questions, but okay, what do employers look for when they're like, I mean, what's a sign that lets you know that they're really into you, that you may be selected? What kind of things would you look for?
I feel like for other people, their tells might be like you can see that they're investing a little bit in you, like they're asking you questions. The interview didn't stop super early. Maybe they ask you to elaborate, like if you didn't answer exactly what they wanted, they like give you another chance versus
Mhm.
like, oh, okay, and then like write stuff down, like
Okay.
head nods, smiles.
Okay. That's good. And always make eye contact with everyone in the room.
Yeah,
I
yeah.
do that. What about when they're writing stuff down? It's like, okay, it's a time to breathe. It's like, okay, I can breathe now. So when they're writing stuff down, what does that mean? Like, are they like taking notes, like seeing who's a good candidate or what?
Definitely not a bad thing. um they have to, or they won't be able to, like, even if they do like you, if they don't write down why, like at the end of the day they might just tell the other people or their manager like, I really like this person, but then not have anything to back it up with. Like they need specific,
Okay.
like, oh, she was able to do this and she demonstrated this, and like this is why I want this person, pick this person.
Okay.
Oh, you know what we didn't talk about is questions at the end, is managers
Okay.
think a little bit
Sure.
differently. They really like at work they're focused on um improving patient outcomes, like whether they're talking about like decreasing infections or like falls or whatever, like that's what they're kind of trained to like help progress the numbers on.
Okay.
um they want
I think
someone who,
I did use that. I just said like, what are your goals for the unit? I think I got that
yeah,
one from you.
yeah,
And it
they
was like,
love to
oh,
talk
so
about it.
we're yeah, they did. It's like we're working on pneumonia protocols and fall risk and making sure that we're assessing the skin.
Thank you for being willing to do
And
that.
I get your mission. I'm a team player. Like I'm all for it. I
Thank you.
appreciate you reaching out to me, even responding, because it's like I wasn't expecting that. I was like, oh my God, she responded to me, but I had already had 3 inner time I saw your message.
I'm
I
sorry.
just need to
I
be
wish
more,
we connected
I
beforehand.
need to be more diligent. Thank you
Okay.
so much for your
Yeah, thank you.
time. It's been wonderful. I felt very comfortable, even though like the questions and just being in that environment where you're being feel like you're on the spot